These are views of the University of Cambridge's Queen's Veterinary School Hospital. Watch this video for an excellent summary of what it takes to work as a veterinary radiologist at the world's most prestigious veterinary school. So, if career success for you means working with veterinary imaging, how do you get there? Melanie Rist earned her degree in radiotherapy and oncology. Working for the National Health Service for 10 years, she then progressed to veterinary nursing, specialising in feline nursing, wildlife and exotics. After that, she was taken on as a full-time veterinary radiographer, where she remains to this day, teaching, researching and conducting imaging procedures. Melanie is also heavily involved in the Cambridge Peregrine group. If you're learning English as a second language, this video will be useful because you will hear two British accents, a northern and a southern one. And before we go any further, I would like to say thank you to my subscribers. Without you, there would be no channel. Working with peregrine falcons and living the wildlife looks like this.
Okay.
Melanie, what jobs are there for veterinary radiologists?
There's quite a variety out there for those that want to stay in clinical practice. The usual routes via the specialist referral centres, but there's also companies now like such as VetCT and other remote companies where a general practice can send images to, and then the radiologist can review them remotely and send a report. So that's quite a big business out there now for places that don't want to employ their own radiologists. But of course, then there's the teaching side of things, the research and forensic opportunities, and that can take people all over the world. One of our radiologists recently was in the Maldives scanning manta rays for a research project. So there's so many opportunities out there. Once you get into the research side of things, it can be absolutely fascinating. And
Melanie, for a bit of perspective, what do you do?
I'm a veterinary radiographer and I'm at the Queen's Veterinary School Hospital. So I am the one that produces the images, CT, MRI, X-ray, fluoroscopy, and then the radiologists will then use those images to help the clinician make a diagnosis. We also do student teaching here. So we do an awful lot with the final year of our students in the clinical rotations. They basically come into the practice, they work with us, so they learn skills hands-on, all the practical skills. We support them with their research projects, and then once they get out into their first jobs and things like that, we quite often get a few phone calls going, what do I do? So we actually have a really good relationship with all of our students, and that's, I think, one of the most rewarding sides of what I do is the teaching and watching these students come in from, oh my God, what do I do, to absolutely blossoming into confident people ready to go out and do that. It's really good. We do also do bits of research at the Queen's Hospital as well. Obviously, one of the big things that they're into is their research. We're working on a lot of clinical trials at the moment, particularly with regard to the more needy dog breeds, things like the brachycephalic syndromes and dachshunds as well. We're working on a new treatment protocol that's just been accepted by the RCVS. That's been set up by one of our neurologists. And the imaging side of that has been very, very useful in helping him develop a protocol to release to the RCVS to be able to implement then across and make it available to everybody. So imaging gets involved in pretty much everything that comes through this hospital.
Oh, that's great. Absolutely great. Melanie, how did your career develop?
I originally trained as a radiotherapist in the NHS, and I worked with NHS for about 10 to 15 years. And then I had to do a career change just because of family reasons. I became a veterinary nurse. I worked in general practice for 15 years. And then when I was able to get my job here, it basically created my dream job. So my radiography background and my veterinary nursing background has come together. I always stuck with the diagnostic imaging. That's always been one of my passions. So the vets, when I was working in general practice, were delighted to have a veterinary nurse there that went, oh, good, x-rays, imaging, I'll do that. And they'd be like, great, I'll go and put the kettle on and I'll bring you a cup of tea. But they knew then they were going to get decent images that we could then make a diagnosis from. So, yeah, it's a combination of both of my careers that's got me to where I've always wanted to be. And I'm so proud and so happy to be doing what I'm doing. And I just want to share that with the students and say, this is what you can achieve. This is where you can be. You can come to work and you can actually look forward to coming to work every day. And there's not many people can say that. I think it's a very, very fortunate position to be in.
Wonderful. Melanie, nowadays people talk about One Health. Did you find that with your previous occupation that married very well and was had lots of transferable skills to bring to your current position?
Definitely. A large part of radiotherapy is planning the treatment. So diagnostic imaging is used in that. And when I was younger, my family were always like, oh, you're going to work with animals. And I was like, I can't do the difficult parts. I just can't do it. But having worked with humans and seen what's available, what can be done, but also the difficult side of it as well, because in oncology, not every outcome is fantastic. And I saw a lot of people suffering. And that has really helped me to move over into veterinary, because I can have the empathy with the pet owners because I've worked with the humans and I had a lot to do with that side, but I can also see, and it made it easier when you can see an animal suffering and you can help that. You can save that and you can give them that little bit of dignity to say thank you for all the years of love they've given to their owner. And to be able to see it from both sides, I think doesn't only help the animal, but it helps the owner as well. And that's a very big part of any treatment that and any work you're doing with the animals.
I'm putting you on the spot a little bit here, Melanie, but for somebody who hasn't heard the expression, what is One Health?
One Health is everybody working together. No one person can do it all. All the disciplines throughout the hospital will come at some point through imaging. So, and we talk to each other. So there's never one diagnosis. There's often lots of other things going on. So everybody needs to work together, talk to each other and make decisions based on that. A clinician can't go into a room and go, right, I know what's wrong with you. Here's what we do. They come to imaging. They go through to lab. They talk to other clinicians. They get advice from their colleagues. They talk to people. They read research papers. So everything that happens in veterinary is not just one person. It's a whole team, and we work together. And we're also working not with the pet. We're working with their owners as well. And we are having to work out what is realistic for what the owner can provide and what is needed for the pet. So it's not just the clinical, it's the emotional, it's the empathy. It is working with everybody to get the best and right outcome for the patient.
Brilliant, brilliant. Melanie, what skills do you need to be a veterinary radiologist?
Aside from being able to sit in the dark all day looking at screens, I think basic anatomy and physiology is the main thing that people need to have. You can look at an image, but if you don't know what you're looking at or you're not familiar with the anatomy and the physiology and how that works within the body, it's going to make the job much more difficult. So yeah, I think it's the anatomy and physiology and its realistic applications for the patient.
For new entrants coming into this discipline, veterinary radiology, Melanie, what skills do they usually lack?
By the time they come to us, generally they decided radiology is what they want to do. But I think the most important thing is to actually go out and work in general practice first, to learn how to be a vet for specialising in something as specific as radiology, because it is just looking at one thing and it's not making the diagnosis, it is advising and guiding the clinicians on making a diagnosis. So having that general practice experience, it's all very well to look at an image and go, oh, yes, well, we can do this, this, and this. But if that's not realistic, or if that's not a holistic type of treatment, it's just something that you've gone straight from vet school to research to radiology. I think actually going out there and being a vet is so important because it gives you more of a grounding. And it also gives you that anatomy and physiology. You've been out there, you've worked with it. So I think that is probably the most important skill to have. Things, the physics, things like that, they can be learnt on the job, but that initial background and that initial base to work from is the most important part.
Mm-hmm. And for those students or new entrants into this who do lack those skills, how can they acquire those skills?
General practice. I think there's so many good new grad schemes out there now. I think all of the corporates do very good, very supportive new grad schemes. Do them, make the most of them, get everything, because you're going to be surrounded by people that want you to learn and they want to teach you. And those skills, I think, from general practice are essential, and they're there. Enjoy them, because they're going to be some really good days. Every day you're going to feel like you've learned something, whether it's what to do or whether it's what not to do. But those places, those general practices, that's where you talk to your owners and you can make some great friends of owners, and just get that bond with your patient that I don't think you can't learn from a book. You've got to go out there and be a person.
What are the protocols involved in imaging?
It's radiation safety. At the end of the day, that's what we base everything on. So I think most students will have heard of the ALARA principles, so as low as reasonably achievable. That's following the ionising radiation regulations 2017. To make sure that any dose to the patient and any dose to staff and to anybody else around is kept as low as possible. That's using PPE, making sure you're getting a good diagnostic image with basically as efficiently as possible. So avoiding retakes, get it right first time. Don't take images, don't take exposures you don't need to just for interest. Following those principles, you want to keep radiation dose as low as possible, and that's what everything is guided by, and that's why we make sure we get the best people to do it, to keep that as low as possible.
Mm-hmm. Oh, that's an absolutely perfect answer. Thank you. Melanie, how would you describe imaging today? And if relevant, what effect, if any, does politics have?
There's so many more imaging modalities available now in routine veterinary practices than there were even when I first started as a veterinary nurse. Initially, it was a vet would have a bit of an idea about ultrasound and we'd take x-rays. Now, a lot of the decent practices, they've got endoscopy. They will perhaps have a certificate holder in imaging. So rather than just going, okay, I can do an ultrasound and find a pio, they can now go out there, they've done their certificates or they've had that interest they've worked on, and they can do an abdo ultrasound scan and they can make a diagnosis based from that. Also, CT and MRI is a lot more available to clients as well. And with more and more pets being insured, it makes it achievable. Okay, they're probably more at the referral centres, but because of that insurance, because cost, whatever happens, it's always going to be a limiting factor. But so economics is always going to be a big part, and you want to make sure that the clients and the patients have got access to what they need in a way that they're not having to travel halfway across the country, which is how it used to be. Now there's something there, and there's something probably within a 30-minute journey.
Brilliant, brilliant. Melanie, what questions regarding veterinary imaging, I'll start that again, shall I? I'll just put my teeth in, excuse me.
That's fine. That's fine. Have you had your coffee this morning?
I've got it right here, actually. I'm just
Marvellous,
regretting that it
marvellous.
wasn't a glass of water and would have been looked a bit more BBC-ish. Instead, I've gone GB
That's
News.
another big thing of veterinary radiology. You've got to have the coffee pot on at all times.
Melanie, what questions regarding veterinary imaging and teaching would you like to see answered in the next, say, 5 years?
I think there's always questions. That's how we move forward in any discipline. There's a few specific things that I have thought of is, firstly, we use contrast agents a lot, certainly now with the advanced imaging. And there's a lot of literature out there in human medicine on side effects and how that is handled, but there's very little in veterinary literature. So, it would be worth trying to find that answer and seeing if we need to keep animals on fluids after giving an IV contrast agent, particularly as they're probably unwell in the first place. So do they need extra support once they've had their procedure to make sure we reduce those side effects? I think that would be probably something quite interesting to look into. Also, I'd like to know, how does the teaching of imaging vary across the UK vet schools? I know at Queen's, we are very hands-on. We do lectures in the first 2 years, but so in their final year, they come in and they actually do it and they spend time with us. I don't know how that varies across the UK vet schools, because a lot of schools do send their students out somewhere else for clinical practice, whereas here they stay in-house, so they're around people they know, and I think they feel quite comfortable to ask us things. Whereas if they're going to somewhere they don't know, the first thing they've got to learn is who these people are, how do I talk to them, where is everything, before they even start learning. So I'd like to know how it varies and how we, can that be mainstream? Is there a way that the students learn better? Because at the end of the day, they're the ones that are learning the subject. They're the ones that have got to go out there and do it eventually on their own. And if we can help them feel more confident in that, I know a lot of the students here go out feeling confident. Is that same across the country?
Great, fantastic. Melanie, can you suggest a research topic for a veterinary student watching this?
Yes. The one that I would like to see done actually isn't imaging related. I mean, the two questions that I've just answered would also be good research projects, certainly with the contrast agent, but I've got a little bit of a personal interest on something I would like to see done. I would like to see a study into symptomatic versus non-symptomatic trichomonas in free-living peregrines in the UK. I've got a very specific interest in peregrine falcons, always have had, and I'm very involved in peregrine conservation, particularly in Cambridge with our nesting pair. There's a lot of reports, anecdotally, among people that I converse with on the conservation groups, that say they have chicks that they've had with trichomonas and perhaps have died or perhaps have been treated. And if you look into the literature, there's a lot of papers out there on goshawks. There's a lot of papers from the US, but I can't find anything in the UK. There's so many Schedule 1 ringers now that ring the chicks from the nests that have got nest cams on. If they've got a Schedule 1 license and the appropriate training, they could easily take a swab, send it in, and then any student would be able to go up to ClinPath, look at it under a microscope. Yes, this one has got the trichomonas there. No, it hasn't. Was it symptomatic? Wasn't it? I think it would be an easy one to do with the right contacts, to get a lot of information, because there's a lot of information now about avian flu. certainly the coastal peregrines are more prone to it, but even now they're starting to do a research project. Some people on the People for Peregrines website are doing a research project into, can peregrine falcons carry avian flu but not be symptomatic and not pass it on? It's just something they're learning, and their bodies are adapting to, okay, we've come into contact with it, it's not a problem. So, trichomonas is another thing that is out there. It is very relevant, and I probably see that more often, especially with the more urban peregrines. They eat a lot of pigeons. Pigeons are less likely to carry bird flu, but they're much more likely to have trichomonas. I mean, how many vet students will have seen a pigeon with frowns? So I think that could be something that can start to affect the UK populations as they're becoming more urban. Sorry, a bit passionate on that one. I'm afraid I can talk about peregrines for hours.
Well, let's do that. Oh, that was brilliant. That was brilliant.
There's a lot more coming out now as it's becoming, as more people are learning it, and they probably started off with John's book. So I would always recommend that one as somewhere to start with. And then I say there's lots coming out now. Very big person that has written books in the UK about the urban peregrine, because peregrines are now changing. They're becoming less coastal. On the various websites, if you have a look at the distribution of peregrines now, they're becoming less coastal. They're becoming more inland, certainly in the UK, and more urban. So things, I say, are changing very much there. So start with John's book, and then work from there would always be my thing for peregrines, I'm afraid. With regards to imaging, I would need to look up the title and the author, which I can send you as a link to put with this, because there is one that we do recognise. That's why I don't know the name, because we just call it the Imaging Bible. So I'll send you the information on that one, so you can put it as a link, because anybody that is interested in veterinary imaging, that's the one I would say to get. It's not cheap, and there's a new edition coming out now. But if you're into imaging, that's what it will be, the one to get. It's our go-to. It's the one that we always go to.
Students who are completing their studies and really ought to be looking towards the conference circuit, are there any conferences either on veterinary radiology and imaging that they should be following, or indeed on veterinary aspects of birds of prey and peregrines?
There's not many specific birds of prey ones out there, unfortunately. Otherwise I'd go to them. I would be there all the time. I know now it's Great Western used to do some courses on avians. I've been to a few that Neil Forbes has run in his time. I don't know if they still do them, but a lot of that is quite specific and going out to the different teaching hospitals, or even to the bird of prey centres. I spent some time last year at the Hawke Conservancy Trust with Cedric Robert down there, and the vets that he uses. And when it comes to handling birds of prey, it's all very well knowing the medicine, but if you don't know how to handle a peregrine without, I mean, they're not going to hurt you really. Their feet can be quite strong, but you want to make sure you don't, it's that veterinary thing, do no harm. So you need to know, we're taught how to handle a cat and dog, but if someone brings you a golden eagle, you're probably going to think twice about picking it up and giving it a pet. So have a chat to the rescue centres. I say Cedric at Hawke Conservancy was absolutely fantastic, and I know a couple of my students have been down there to see him since and got an awful lot from just those experiences with the bird handlers and the vets that do the health checks. With regards to imaging, there's quite a lot of the conferences for imaging are held abroad. So it's once you're into the imaging circuit, talk to your seniors, because they'll be the ones that get sent the information about the conferences. They're not cheap, but you get contacts there. And once you've got a contact, even if the conference is in the UK as well, so the London Vet Show is a great place to go. Again, you've got your contacts, but the talks and things that go on there, I've learned a lot just from going there and going to the talks. It's not all about going around and getting the freebies from the stands. The talks that go on there, you can pick up a lot from that you perhaps wouldn't come across in your day-to-day practice. So it doesn't have to be abroad, it doesn't have to be posh, it can be the one that's on your doorstep.
Melanie, is there anything you'd like to add?
No, so for people that are going out into veterinary, just make sure you know your anatomy, your physiology, and make the most of the people around you. Because at the end of the day, we want you to learn, and you're going to learn by going out there and doing it. There's only so much in a practical job that you can learn from a book, and until you get your hands on and start pressing those buttons or listening to those hearts to get that frame of reference. So I think first opinion. I know people say, "Oh, I want to specialise in this. I want to specialise in that." Do your first opinion. And sometimes even the neutering clinics, if you want to get your surgical skills up, volunteer at a neutering clinic somewhere for a couple of weeks. You get a holiday, so usually somewhere nice. And I can tell the difference when I see new grad students come through. I can see who's been on those neutering courses and who hasn't, because their surgical skills on their first day are so much better just because they've spent a day and they've neutered 20 cats. And there's really no replacement for that.
And Melanie, the Cambridge Peregrines, is there a group? Is there a Facebook page? What do they do? Do they welcome volunteers?
There is there's a Twitter and Blue Sky page that is at Cam Peregrines. That's run by one of our little group. We're only a small band. We're mostly amateurs, and unfortunately, we haven't got a nesting pair this year. Our local male was killed on the 1st of March, probably by another peregrine. We were somewhat devastated because the female was literally due to lay, and it would have been their 10th year nesting at the nest site in the town centre. So we were upset by that. But what we are mostly doing is running around town now. We have a new male who doesn't like the old nest site, but has taken up residence on the university library. And he's still learning what to do with a female who's in the mood. But we're monitoring now what is going on with them to see what we can do. You know, is there a possibility perhaps that they will eventually move back into town and use the old nest site? Is there a possibility that she will go, actually, no, I quite like the university library, and she will go to where he wants to be? But monitoring that behaviour and seeing that takeover is really good. So the updates tend to go on at Cam Peregrines. And we have our own little WhatsApp group if people are interested in Cambridge and they want to get involved. And, you know, if they see the peregrines anywhere that they see them, because their habits are changing now, any information we can have about where they're being seen, are they perching on new places, are they being seen out of town? That's the sort of thing we want to know. Tell us about their foraging behaviour. We know they hunt out of town because of the prey they bring in, but we don't know where it is. And it would be interesting to know how territories are overlapping, because there is another pair at the Cherry Hinton chalk pits. Isn't far down the road. So there's got to be some crossover. But of course, when you're studying the fastest animal on the planet, it's a bit difficult to keep up sometimes. So the more eyes we have on the ground, it makes our job much easier.
That's brilliant. Absolutely brilliant. Melanie, I think you can probably introduce yourself with your full name and where you work better than I can. So please, can you give your full name and occupation and where you work?
I'm Melanie Rist. I am a veterinary radiographer and I work at the Queen's Veterinary School Hospital in Cambridge.
Melanie, thank you so much for being on the Practical Animal channel. Melanie Rist.
That's right. It's been lovely to talk to you. And I'm sorry I talked too much about peregrines.
You can always come on and talk about peregrines.
You'll need a longer podcast.
Thank you, Melanie.